I'm Dr. Alan Meade. I am the HMG Rehabilitation Director for our group here at Holston Medical Group. And I'm also the chapter president for physical therapy across the great state of Tennessee, and kind of excited about that role when we talk about the November Diabetes Awareness Month and what our role is as physical therapists working with our other healthcare providers in the areas of diabetes. We now currently have physicians, and especially our PharmDs, they will work with the diabetic population to potentially send those patients for a script to physical therapy to at least start or initiate a home exercise program. We try to train them on the exercise regimen. The exercise piece is to get them moving. Maybe it's a diabetic patient that is obese, or they have peripheral neuropathy in their feet. They don't feel their floor, the proprioception is not there. So again, physical therapists can help train in that area, working on, especially in the areas of falls and balance. Think about this, if you're a diabetic patient, you don't feel your feet on the floor, and you don't feel that knowing when you're taking the next step forward, that could lead to a fall, and that's where we are valuably important in that regard. The second area is what we want to talk about is the risk to diabetic patients related to wounds. So why are wounds in the diabetic patient so slow to heal? You'll hear that all the time. Well, I'm a diabetic and I've got this place on my arm and I've got this, but I know I'm going to be slow to heal. Why is that? It's because we have decreased blood flow to that area. The body has a difficult time healing those wounds in that area. Now, we talked a little bit about the diabetic neuropathy in the feet, causing a decreased feeling or a decreased proprioception in your lower extremities. And so we need to make sure that we are doing some of those inspections of our feet, and then also making sure that we are feeling our feet on the floor and we are wearing the proper shoe wear that will even help us in that part of it as well. So what can a diabetic patient do to avoid foot ulcers? What should they be aware of? Well, it's critical that the diabetic patients control their blood sugars. You've got to do that. Make sure you're watching your sugars each day, you're taking your active testing of those sugars each day, and then also making sure that you're trying to avoid the diabetic neuropathy by doing that. So you don't need to go down the path of leading to further diabetic neuropathy if you don't have to. So again, you can curtail some of that if you're properly managing medications, you're managing your sugars and all of that at home. So I want to thank you for this time and this opportunity to talk to you about the diabetic population, where we serve in two areas, which is in the exercise component and of course in the wound care component. Thank you very much.